All right, Pharmacist Interventions Part 12. All of these were yesterday. So yesterday was kind of wild. But I had a provider prescribe viscous lidocaine for a patient who was an infant for teething pain. The FDA recommends against prescribing this in patients less than 3, and I think even less than 12 in the European Union it's recommended against. It's a sodium channel blocker. That's how it works as a numbing agent, but it also blocks sodium channels in your heart. So it can cause cardiac arrest, and it doesn't take a lot to become toxic for patients. But we sometimes use it in the hospital for emergency like VTAC or VFib situations. I don't think I really saw it on my rotations, but it can cause seizures as well. It can oxidize iron in the blood from the ferrous to the ferric state, which can decrease the binding capacity of oxygen, so it decreases delivery to the cells. That's called methemoglobinemia, because it increases methemoglobin in the blood. Again, it has a decreased binding capacity, so that can cause like confusion, basically the symptoms of you don't have a lot of oxygen, cyanosis, stuff like that. It's a class 1B antiarrhythmic. So I recommended against that. The caregivers wanted other options. They wanted to use benzocaine. I said no, because it's in the same drug class, and I recommended ibuprofen, and then following up with the practitioner. Another interaction I had was a patient who was on isosorbide mononitrate as well as Viagra. It's contraindicated to take nitrates and phosphodiesterase 5 inhibitors due to the risk of causing potentially fatal hypotension. So it's recommended to hold your dose of isosorbide mononitrate at least 24 hours after Viagra and 48 hours after Cialis, because Cialis has a half-life of up to 17 hours. This is because nitrates can cause vasodilation, smooth muscle relaxant. That's how the long-acting nitrates like isosorbide mononitrate and dinitrate work for angina or chest pain due to like plaque buildup in the coronary artery. But again, you're not supposed to use those in combination. It's kind of like nitroglycerin, but a longer-acting nitroglycerin. The last intervention that I had was with a patient who was initiating Lamictal or lamotrigine, and they were already on Depakote. So the interaction there is you're going to have an increased effect of lamotrigine when you're taking Develpro-X. So when you're tapering, you already need to taper Lamictal rather slowly, which ideally it's 25 milligrams for about like 2 weeks and then 50 for about 2 weeks. But the provider prescribed it as 25 per week and then 50 for a week, which was already kind of rapid, and you need to extend it even longer when you're on Depakote. So it's supposed to be 25 for like every other day for 2 weeks, and then 25 daily for 2 weeks, like that, due to the risk for toxic epidermal necrolysis as well as Stevens-Johnson syndrome, which can potentially be life-threatening, so you need to taper it very slowly, very cautiously.